Hello everybody! Today we're here to share our quality improvement project named Project Sedap, improving quality of care for residents with dysphagia through 3D-moulded puree meals at a long-term residential care facility. Based on overseas studies, oropharyngeal dysphagia prevalence is about 40 to 60% in residential aged care facilities. Puree diets are routinely used for people with dysphagia. However, research to date has shown that puree foods have poorer nutrition, and changes in appearance and texture of puree foods may result in decreased oral intake. Interventions have been trialed overseas to improve presentation of puree foods into moldable shapes that resembles its natural form. This has shown to increase the amount of oral intake. At present, there are no guidelines in Singapore for the implementation of moldable puree foods in a long-term residential care facility. In this long-term residential care facility, the puree diet is served in a single bowl where the foods are first blended together before serving. This pilot program aims to determine if the use of moldable puree foods can improve oral intake in patients in a residential long-term care facility in Singapore. In collaboration with Silver Connect, a food vendor, 3D-shaped puree meals in bento boxes were developed in this facility. The menu was designed in collaboration with the head nurse and director so as to include local delights such as chicken rendang, asam fish, and lemon chicken. This study was a 3-week pilot study with the care facility's nursing approval for collection and analysis of non-patient identifying data. Pre-post design was used with 5 residents with dysphagia on puree diet. All 5 participants are neurologically impaired and were exposed to control condition named bowl and treatment condition bento. In week 1 of the pilot study, data was collected at both lunchtime and dinner time for puree meals from the kitchen in the standard form, named bowl. In week 2, moldable puree foods were served for lunch and dinner in the moldable format called bento. In week 3, the residents were then served the puree diet from the kitchen in the standard format for both lunch and dinner.
We had communicated the change model to everyone in the team as shown in the diagram below. A trial run was also completed with the staff before the intervention to ensure that data collection methods were accurate. The main outcome measure of the project is to find out the amount of puree foods consumed by the patients, and this is measured in grams. We have also completed a survey to indicate if the puree foods maintain their appearance and consistency before serving, as you can see in the picture. This was completed mainly by the nurses, as most of our residents in the study were not able to communicate this information to us accurately. A mixed model analysis was run to determine if there was a statistically significant difference in the consumption of moldable puree foods compared to the original puree diet from the long-term residential care facility. As you can see in the diagram below, we have found that the residents consume more food in terms of the weight of the food in grams from the 3D moldable bento meals as compared to the existing bowl meal. The red line represents the bento meals, while the blue line represents the bowl meal. And these were collected for lunch and dinner separately. The p-value of the difference is less than 0.05, and this suggests a statistically significant difference between the two conditions. In conclusion, moldable puree foods can be a potential way to improve oral intake in residents with dysphagia in other long-term care facilities. However, it would be important to increase the number of participants in future studies and to trace the study over a longer period of time. We may also consider including a dietitian so that she can do a nutritional analysis with additional outcome measures. We can also further analyze the efficiency and cost of preparation of such moldable puree foods as compared to the traditional puree food methods.